All right, so our next caller is somebody who says, I'm 53 years old and I had my last bottom wisdom tooth removed 3 weeks ago. I've been experiencing severe discomfort from my wisdom tooth extraction for the past 3 weeks, and it hasn't improved. I've lost sensation in my bottom teeth, and the pain in my chin is excruciating. Nothing seems to alleviate the pain, and it's causing me to feel depressed and frustrated. Additionally, I've developed a sore on the inside of the bottom of my lip due to the trauma. What can I do to manage the pain and soothe the nerve? Will I require surgery to address the issue?
So, so it is a really long question, and to summarize this, and I can only I'm going to say that the scholar is experiencing a lot of pain following a wisdom tooth extraction, and she also has received some trauma or some kind of a burn to the lip, and also she's also experiencing some type of loss of sensation on the lip or the tongue following the procedure. So it is a three-part question. The simple thing is the trauma that you may have on the lip. If it is related to what we call it as retracting or pulling your lip during the procedure, and more than likely it is going to resolve, and it may take up to maybe about 4 to 6 weeks or up to 8 weeks or a few months, and I'm hoping that it is going to completely resolve. To address your immediate concern, which is the pain that you are experiencing, and whether you are going to need any type of surgery. And if it is a simple, what we call it as a most of the time, the pain that you are experiencing, it could be as simple as what we call it as a dry socket. You may not need a surgery. It could be as simple as you may need a prescription for an antibiotic, or you could be needing a prescription for a pain medication, or maybe even a stronger pain medication that could take care of the issue. Whether you are going to need a surgery or not, I want to say you don't need a surgery, but sometimes the best possible option for you to what we call it as a debridement surgery. What it involves is it could be as simple as giving you some type of numbing, and then we open up the gum, the surgical site, and we what we call it as a cleanup. It could be related to some kind of a food getting stuck in the area, which could be causing irritation to the bone, or you may be a smoker, or you may have used a straw accidentally. That may have caused what we call it as a dry socket. So it may involve opening up the gum tissue and cleaning it out and induce some fresh bleeding, which is going to take care of the pain. So it could be as simple as, and although it is a surgical procedure, it could be simple, and we do this procedures several times during the month, and it could be like a 10, 15, 30-minute procedure, as simple as that. And to answer your third question, is your nerve damage. Looks like you lost some sensation in your mouth. If it is a tongue or the lip, which is the most common site after the following an extraction, and most of the time it should resolve. And again, talk to your dentist, and we do treatment as simple as giving some vitamins, or giving you some steroids following the procedure to take care of the issue that you are experiencing, which is the numbness. And I would be concerned only if your numbness is not going to go away several weeks after the procedure. We normally wait for about 6 to 8 weeks, and then if the numbness does not resolve, then we take further actions. And so depending on where you are in the journey of the recovery, talk to your dentist, and they should be able to help you. If you happen to be in a surgeon's office, again, they should be able to follow the protocol of giving you the medication, and if the numbness does not resolve, then they can initiate further referral for you to a neurologist or a microneurosurgeon, and that should be the course of action for all the problems that you're experiencing.
Awesome. Thank you for answering that question.